Thyroid glands. Okay, I have some good news and bad news. The bad news is you have to know about the endocrine system on the NCLEX. The good news is, just like everything else on the NCLEX, you really just need to know what every other new graduate nurse knows about the endocrine system. Now, it's not going to be like going back to anatomy and physiology where you have the anterior pituitary gland and the posterior pituitary gland and what comes from where and who controls what and, all these hormonal cycles and all the different influencing. Just stop. Don't even worry about that, right? Because nobody remembers it and nobody's able to apply that on the NCLEX. So if they are able to, those are going to be really difficult level questions. And if you get those correct, then that's fantastic, right? You're going to get out of the exam sooner. But if you miss those questions, it's not going to make you fail the NCLEX. It's not going to be a big deal because everyone else is missing those questions too. But one of the things that you do need to know is about the thyroid gland. Okay, so don't be freaked out about the thyroid gland. We're going to break this down, and you'll probably find it pretty straightforward at the end of this lecture. Because before we dig into this, when I ask a group of students in the live lecture series that I do, how many of you can name, 5 signs and symptoms of hyperthyroidism and hypothyroidism? Well, typically, very few hands come up when I ask that question. But at the end of this, when I ask you the same question, every hand in the room goes up because of this strategy. So what I want you to do is whenever you hear the word thyroid, I want you to replace it in your head with the word metabolism. Okay, so if you see it or hear it and it says thyroid, just make it metabolism. Okay, so hyperthyroid, you should think hypermetabolism. All right, hyperthyroidism, you should also think hypermetabolism. So now, if I asked you, like I said a few minutes ago, about what you would say for the signs and symptoms of hyperthyroidism, you might struggle with it. But what if I said, what are the signs and symptoms of somebody with hypermetabolism? Are they going to be chubby? Right? That's not a medical term. Chubby is not a medical term. But will they be skinny? Yeah. Right? Could they be cachectic? Right? That means skinny. Right? Emaciated. These are words that are associated with being skinny. These are patients who they're never cold. They usually have an elevated blood pressure. They are hot. Everything is hyper in them, right? They're tachycardic. Everything is high and elevated. They're just moving all the time. And, this is also called Graves' disease. A good way to remember this is that these patients, you've heard the phrase before, somebody running themselves into the grave, right? These patients literally run themselves into the grave. These people are always moving and they're never sitting still. They just never stop. Okay, so hyperthyroidism is known as Graves' disease. And remember that these patients run themselves into the grave. So how do we treat it? How do we treat hypermetabolism or hyperthyroidism? So option A is we can use radioactive iodine. And that's going to destroy part of the thyroid. And the idea with that is to just destroy or reduce the function of it so that it brings them back down to a normal state. You typically don't want to destroy the entire thyroid with that, but sometimes that does occur. So for these patients, you need to know that their urine is dangerous, right? Because we put radioactive isotopes, radioactive iodine in their body, right? And their body's going to be excreting it through the urine. So for these patients, they should have their own bathroom at home. They should flush the toilet 3 times. They really want to get rid of that urine. The option B is a drug called PTU. And PTU stands for propylthiouracil. And for PTU, what I want you to think of is that PTU should stand for puts thyroid under. Okay, so this is a drug that's used to manage hypermetabolism or hyperthyroidism. And for these, we want to watch their white blood cell counts, though. So you want to scrub your hands and no grubby. And option C is a thyroidectomy. Thyroidectomy. which is basically a surgical removal of the thyroid. And there's two options. You have a total thyroidectomy or a subtotal. Another word for subtotal is a partial, right? So for total thyroidectomy, we're taking out their entire thyroid gland. So now, what is controlling their metabolism, right? So they don't have anything for that. So they're going to require lifelong hormone replacement. Right? They are at risk for hypocalcemia because typically they remove the parathyroid gland also, which helps with calcium regulation. And so we're going to watch for hypocalcemia. Signs and symptoms of hypocalcemia is tetany, right? So the first sign of that is paresthesia. And you're going to have post-op risks for this. So for the first 12 hours, the risk is going to be airway, okay? Because that's where the thyroid is, in the throat. So you're going to watch for airway in the first 12 hours. And after that, from 12 to 48 hours, you're going to watch for hemorrhage. And what are some signs that a patient may be hemorrhaging and not realize it? If it's coming out the front of their throat, down their chest and the abdomen, you're going to notice it, right? You're going to see the blood. But what if it's staying internally? You may see them making a swallowing motion, or they may be complaining of some nausea because that blood is collecting in the stomach. So that's a big thing. 12 to 48 hours is hemorrhage. And then any other sign or symptom of hypocalcemia. So be sure to listen to the lecture on electrolytes. And that way you'll have all the information you need to know about the signs of hypocalcemia. Okay, now for a subtotal thyroidectomy, they are at risk for going into thyroid storm. And you may also see it as a thyroid crisis, or another word that you may see, again, this is where vocabulary is really important. You may see the word thyrotoxicosis. Okay, those all mean the same thing. Thyroid storm, thyroid crisis, or thyrotoxicosis. Now, the signs and symptoms of a thyroid storm are crazy high vital signs. So like pulse in the 200s, they have really high fevers like 103, 104, 105, 106, like really high fevers. And that fever can cause some delirium. Now, what is delirium? Right, so we talked about that in the psychotic lecture, psychotic versus non-psychotic. So make sure you review that one for the signs and symptoms of delirium. But for that delirium patient, we want to remind them, reassure them that it's okay. You want to first acknowledge their feelings, let them know that it's okay and that they're safe and that this is a temporary experience because of what's going on with their thyroid and that it will resolve. Okay. So for the treatment of this, you need to treat the symptoms. There isn't a whole lot that the medical team could really do. So what we're going to do is we're going to pack them in ice or put a cooling blanket on them to try and alleviate some of that temperature. And we want to give them oxygen. We want to give them a lot of oxygen. You'll probably get an order from a physician to put them on a mask because a nasal cannula won't provide enough oxygen. And then post-op risks. For the first 12 hours, again, is going to be airway. The second is from 12 to 48 hours is hemorrhage and thyroid storm. Okay, so when you're doing patient prioritization questions, you want to consider the implications of thyroid storm on your patients. So when you're prioritizing them, if you have a delirious patient who is post-thyroid surgery, that's somebody you want to go see first. You're going to want to check their latest vital signs, and find out what their current status is. That's not something that you expect that patient to experience. Okay. Now, what about the other way? What about hypothyroidism or hypometabolism, as we should think about it when we hear it and see it? This one's a whole lot easier to treat, and the signs and symptoms Well, what are the signs and symptoms of somebody with a slow metabolism, a hypometabolism? Do you expect them to be, slender? No, right? These are typically patients who are lethargic. They are bradycardic. They may have an increased BMI, the body mass index. Okay, so this is also known as myxedema. Right? Myxedema is hypometabolism. Right? So for the treatment options, this is just going to be like treatment for the patient who had a total thyroidectomy. This patient does not have enough thyroid hormone, so we're going to give them some. Right? They'll have orders for thyroid hormones. Now, for treatment considerations, let's do some critical thinking. This patient has a decreased metabolism. What does that tell you about how they will be metabolizing their food? Right? Well, that's why they're heavier, right? Because they're not metabolizing food as well as a patient with a normal thyroid function, or with the patient with hyperthyroidism, with hypermetabolism. These hypothyroid patients who have hypometabolism, I know this is annoying when I keep repeating those words, but you need to put them together. Hypothyroid and hypometabolism. I keep repeating it for emphasis so that you fully understand this concept. Patients who have a hypometabolism don't metabolize food as fast, but they also don't metabolize drugs as fast. Okay, so this is an important treatment consideration because you need to watch for other signs and symptoms based on the type of medications that they're receiving in addition to their thyroid hormones. Because when you start to give them pain medications or sedatives, they're not going to process them as fast, and they already have, for the most part, a decrease in their vital signs. So they're already probably bradycardic, they're already lethargic, they already have lower respiratory rate. So when we're giving them sedatives, you need to watch. Okay? So really, that's it for the thyroid gland. Okay? You need to know the basics. And if you can wrap your head around the concept of what does a patient with hypermetabolism look like and what does a patient with hypometabolism look like, you should be able to rock out any question about the thyroid glands and about treatments, and to be able to start to use that as a foundation for your critical thinking. Right? So that's it for the thyroid.